The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Dr. Tom here. Welcome to another edition, if you will, of Dr. Tom Roselle Live. I got a really good program for you today. But I want to wish all of you in the Christian faith a happy Palm Sunday. And we're into Holy Week, and I hope it's a blessed time for you. And many of us are going to have to ask for a little penance along the way. And that's including yours truly. But we're going to be doing that. Obviously, I was raised Roman Catholic. And, often I will say to friends, and kiddingly, I said, probably a better Buddhist Catholic than anybody else's. But having said that, seriously, it's a time for reflection. It's a time for understanding what so much was given for us to do what we, should be doing on a day-to-day basis, and loving each other as best we possibly can, and forgiving each other as best we possibly can. And that's the time that we get to, choose and reflect upon this coming week. Having said that, let's get into the program. And I want to remind you that, after, WMAL 105.9, Dr. Tom Roselle Live, I immediately go into a live stream broadcast, and you can find it virtually anywhere if you're on social media sites, or if you're on our mailing list. We're going to let you know that it's there. And we're going to be talking about 5 types of pain on the live stream today that are easily treatable, and that rolls into this coming Wednesday evening's in-house presentation, if you will, at the Roselle Center for Healing in Fairfax on April the 16th at 6 p.m. Why don't you join us? If you have pain that won't go away, if you've been putting up with for such a long time, if you're on all kinds of drugs and medications that just don't cut it, and it's taken its toll. It means there's side effects to all these things, whether they're anti-inflammatories or muscle relaxants or things like methotrexate, and you're on the last piece of the puzzle where your body's hurting all the time and you don't know what to do. Well, this may be your opportunity. This Wednesday evening, Dr. Stephanie Pina and I will co-present, and it's going to be an interesting topic. I'm going to show you specifically what happens, what the signs and indicators are, but more importantly, that in the greatest majority of cases, and we're talking about, 90 some percent, that pain can go away if you understand what the pain is all about and you treat it accordingly and you're willing to do the things that are necessary to make it happen. So at the Roselle Center, we're a group of natural integrative practitioners from acupuncturists and chiropractors who specialize in an area called applied kinesiology and nutritionists and massage therapy and so forth. And we do all kinds of things with scalar energies and lasers and you name it. And we're going to show you some of those things and demonstrate that. So join us. You can do it in a couple of different ways. Go to rosellecare.com. That's ROSELLECARE.com, rosellecare.com, and register for the class. Alternatively, you can do it at drtomroselle.com and make it happen that way. And by the way, all of our old podcasts and radio shows and so forth are located on both websites, so you can check them out anytime that you'd like to. And then the third way is the old-fashioned way, right? Pick up the phone, 703-698-7117. That's 703-698-7117. And we'll see you on Wednesday evening. But let's get into the meat of this program, because I want to talk to you about a pain presentation that a lot of people don't think about. I've mentioned it a little bit and on different programs, and it's called, for lack of a better term, it's recidivistic or wind-up pain. But wind-up pain, not going to a threshold of, oh my God, what am I going to do with it now because it keeps getting worse and worse and worse, but pain that keeps presenting itself no matter what's done. And sometimes it's an emotional trigger, sometimes it's a structural trigger, sometimes it's a biochemical irritation. And something as simple as just smelling something often will do it. And so there's many linkages. So what are we talking about? Well, in my world, we're talking about something that the body is re-stimulating. We call it injury recall. So the body is recalling a trauma or an injury. It's recalling an insult, and that insult can be emotional, that insult can be biochemical. So to be able to fix it, you have to know what really took place and you have to deal with that specific situation. So just for sake of understanding, let's put it into a time frame. And we're going back, in your life, maybe 30 years ago, maybe 10 years ago, maybe 4 years ago, maybe you're as old as I can go back 50 plus years ago. And you forgot about something that had happened, either biochemically, emotionally, or physically, an accident that took place. So let me put it in context for you. Let's say that every once in a while, you don't know why it happens. You get this ugly pain in the back of your head and your base of your neck going into your shoulders, and it's really, really sore. And so you come into the office, and I ask you, when do you notice this? And, oh, when it's there, it just lasts forever. So we dig a little deeper, and I said, when was the very first time? And you sit there, what do you mean? When was the very first time? When was the very first time that you actually experienced this pain pattern? And they look at me and I'll say, okay, so let's go back 30 years ago. And if obviously if somebody has got 30 years on their platform. And they said, did you have it then? And they looked and they said, no. Okay, great. So let's go back 25 years ago. Did you have it then? And they reflect and I said, how old were you 25 years ago? They tell me, where were you living 25 years ago? What happened maybe of impact 25 years ago? So all of a sudden they say, well, I was, in a little bit of a fender bender. I didn't think too much about it. I was sitting at a stoplight and somebody came up and rear-ended my car and I was sore and I had the headache you have now. And they stopped for a second and I said, yeah. And I said, okay, so what happened? And they said, well, I had, some physical therapy and I, you know, seemed to be better, but I said, was it gone completely? And they said, well, no, not really. It was always a little bit there, but I didn't think too much about it because I can function. It didn't take anything away from me. I said, but you were in pain, right? Yes. I said, so when does it get worse? And they look at me, well, what are you talking about? When does it get worse? Do you notice that if you're in traffic, that all of a sudden you go home and you're sore and you hurt and your head is tight and you're looking forward just to get in the house and relax because when you go home and you say, well, it's just the traffic, living in the Washington metropolitan area, it's just I can't take the traffic. Well, the real answer is that when you were in that traffic 25 years ago, you had an accident that the body has not fully neurologically recovered from. And that's called injury recall. It's recalling the injury. And what takes place is that old injury, that pain that came about because of that we'll call it nociception. And what that really is, nociception is the process of stimulating, something that is consciously and unconsciously uh, a pain presentation. And the signal generated by these, we're going to call them nociceptors. Okay, nociception, nociceptors are just, receivers. These nerve receptors, if you will, that are the end of, the the injury that were stimulated aberrantly, and now it's affecting both the external nervous system called the peripheral nervous system, or the inside, the brain, the spinal cord, the central nervous system, and it's interpreted as pain being still there. That stimulation, that upregulation of the pain hasn't gone away. So there are three main types of these presentations, if you will. And one we can call and this is all mechanical, from a mechanical pressure, the hot cold, that's chemical stimulation as well, and then the There's a process of these histamines that are involved in inflammatory reactions that kick in and so forth. Anyway, but you can do it just by memory as well, because that memory is buried deep inside. Unless we bring it to the surface, which we do with things like neuroemotional technique and neural flag technique and so forth, or emotional flag technique, it can be brought to the surface and then treated and then eliminated. So it's important that you understand that that pain that you're experiencing is is present for a reason. And so we want to really bring into an understanding that it's not all in your head. Well, if it's an emotional trigger, it might be partially there in the limbic system, but it's also that's your emotional brain, by the way. Need I say more about that? So here's the thing: they are real presentations. It's not something that you're making up and you're in certain, is it the stress of being in the car and driving? No, then why don't I have it when I'm out in the middle of traffic? Why doesn't somebody else have it when they're out in the middle of traffic? But it's you in a very specific neurologically recognized condition that stimulates that pain, the memory of it, because it's locked into the nervous system and the body goes into an upregulatory cycle, bringing it there. So the next thing you know, you're popping all kinds of things, trying to get your muscles to relax. You're taking your Advil. Then pretty soon when that doesn't work, because that's where we get the upregulatory wind up process, it gets worse and worse over time under the same stimulus, and then we blunt it down. Now, with all of those meds and medications who have side effects, we end up producing other types of conditions. Now, this Wednesday evening at the Roselle Center for Healing, I'm actually going to demonstrate this. I'm going to show you what takes place. The acupuncture system can be involved. Did you know that if you have an injury that uh, was a cutting injury, meaning it left you with a scar, and scars, by the way, may be internal. You may not even see them on the surface. That when that scar happens to cross an energy channel called the acupuncture system, and depends on where it goes to, can cause you pain at the terminal point or the beginning point. Now, let me make that a little clearer for you so you understand it a little bit better. You know what gout is? So gout is the production, the abnormal production of these uric acid crystals from the liver, gallbladder area. And it's because, they're going to tell you because you don't eat the way you're supposed to, and that's true, by the way. If you're eating way too rich, you're drinking too much alcohol, eating much more red meat than you should, drinking coffee without enough hydration and so forth, you're going to end up with a gouty attack. So that gout goes where? The big toe. And the reason for it is that the energy gets stuck down there because that's the first point in the acupuncture channel for liver. So it gets stuck. It's called stagnation. Now, what may be causing that stagnation instead of your dietary patterns being bad is that there was a trauma that crossed over that area. And now all you have to do is re-stimulate that trauma that crosses that acupuncture channel. And for no good reason, all of a sudden that toe of yours is throbbing like crazy. And oh, by the way, you're going to end up with a headache. And because the back of your head and the front of your head are very, very suspect when it comes to gallbladder, liver types of congestion and headache. So when you know that to be true, which we do, and we see it all the time, so certain things have to be done. One, you want to make sure that you get rid of the pain pattern, reproductive cycle. So that means we've got to reconnect the situation. Now, the easy way of doing that, so we can find it. The body is an amazingly efficient reporting system. So in our world and of applied kinesiological principles, applied kinesiology means muscle function as it relates to and is applied to many other systems. And so we look at the traumas, which we said earlier, that's structural, right? Biochemical traumas and emotional traumas. And we look at where it was initiated. So, but now it's not showing up. You're in my office. It's, you're sore, you're complaining of these dull headaches, you got neck and shoulder pain, and but it's not at the sensory level where you told me it can crank up to a 7 or 8, and but it's always there, it never goes away. So after we investigate and we begin to look at your body's presentation and how it really presents itself, okay, all I have to do is test a muscle, and that muscle is what we call strong or normally facilitated in the clear. It means I test the muscle, there's nothing obstructing it, and it tests pretty well. And then we tap just an impact, maybe about 4 or 5 pounds of pressure, very quickly over the area that you had the injury to. This situation might be the middle of the neck. It might be the back of the head because when you got in that accident, it threw your head back and you smacked it. It could be, if you were in a sports accident, it could be a knee problem or something. You tap that, but now what happens to that muscle that's normally strong is that muscle immediately on testing will weaken. So it tells me that we got a problem. And if we don't get rid of that injury memory, that injury recall, it's never going to go away. And in many situations, it just gets progressively worse because now we're, numbing it down. We're taking all these different medications. We're taking these drugs, and things get progressively more difficult, if you will. And the pain, the discomfort that somebody experiences because of the blow, the trauma, is always there and continues to spin on itself and get to where it needs to go. And by the way, if you'd like to know where all this came from, there was a podiatrist of all people way back in time by the name of Robert Crotty, Crotty, and a friend, a colleague, if you will, Gordon Bronstone or Bronston, and they were both. It's based on patterns of observation that were resulting from a history of injury and trauma and pain production, and the uh, it was the only thing that they could find relative to the patient's history. And then they began to investigate and they looked at muscle patterns. They looked at how it was affecting and they started looking at the different things. And then in my world, there was a brilliant, brilliant doctor by the name of Dr. Walter Schmidt. And he went to Dr. Bronston as a result of a foot injury. And Dr. Schmidt is no longer with us, but when nobody could help him in our world, and we do some of the best work there is when it comes to muscle function response testing, particularly in the athletic world. But Dr. Bronston was able to fix it. And Dr. Schmidt was so impressed, by the experience that he had. It resulted in and put together a very simple technique in our world to be able to resolve the process. And here's what happens. There's a couple things happens. Either the pain goes away immediately, okay? It goes away immediately, or now it brings everything up on the surface that you can identify to be able to fix it. And now the body goes through the process of being able to heal as long as we keep assisting and supporting it. And for the first time, that 7 or 8 level pain is no longer there at that level. It gets down minimally down to 1 or 2, and then we can be able to look at the other things that are not working the way it's supposed to. Isn't that amazing? I've dealt with professional football players and basketball players, and over the entirety of my career. And a lot of these guys come in and they're so used to being beat up. They're so used to having pain. They're so used to dealing with things, as many of us do as well. We just, put up with it. That's life. What do you expect for your age? Type of attitude. But you find it and they kind of look at you strangely and say, how did you know that was there? That's not what I came in for. Well, the body tells the story and it's stealing the functional capacity the integrity of other systems to work hand in glove as they were meant to work hand in glove. So when you know those things are being inhibited, meaning functional capacity of normalcy, are being inhibited by something, it's not okay just to throw a drug at it. It's not okay just to say, well, what do you expect, for your age? It's not okay to say, well, everybody has that type of problems. Well, my brain goes, what can I do to fix it so the patient, the athlete in our own home, if you will, can live a life of being out of pain and optimizing what they do. So if you have these IRT injury recidivistic patterns that are showing up, you have to be able to set the process in motion for it to heal. And we see so much of it lining up with the neurological platform and the acupuncture platform. And once we understand that, we can predict, and we find it, we can predict the issue. We're coming up pretty quickly to the end of the program. I want you to follow me immediately on drtomroselle.com. That's where the live stream can be found. If you haven't gone there before, it's real simple, and you should. Shame on you. Go to drtomroselle.com. Give us your email. We'll send you all kinds of things. Not going to solicit you to buy stuff. We're just going to give you information about your health. This could be a good program. Remember, I'm going to cover 5 things that are treatable in the next part of the program on the live stream. And if you have a question, that's the site to go to. Send me a note or go to rosellecare.com and check out what the Roselle Center for Healing does. All right, we're coming up to that place where I want you to follow me. Remember, we're here on an ongoing basis every Sunday at the same old time at 12:05 on the heads up, right? And remember, I'm here for one reason only. I love you all. Okay, let's go. Meet you in live stream.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.